Hi, I'm Wen-Hung Chung from Taiwan. I'm from Taiwan Chang'e Memorial Hospital, Department of Dermatology. I'm happy to have the interview to talk about my plantar section talk in the WCD. Cutaneous adverse reaction is caused by abnormal reaction to medication. It can be through immune or non-immune reaction. Immune-related cutaneous adverse reaction is mediated by immune cell, such like T cell, also called the type 4 or delayed type hypersensitivity. And another type is immediate type or called the type 1 reaction that is caused by antibody that commonly seen by IgE. The clinical manifestation may vary from very mild skin reaction to severe life-threatening reaction. The mild reaction, such like urticaria or maculopapular extension, or more severe reactions such like anaphylaxis or delayed type reaction such like Stevens-Jones syndrome, toxic epidermal necrolysis, or trace or HF. The time to develop cutaneous adverse reaction is depend on the type of reaction. In immediate type reaction, they usually develop as soon as the second to several minutes after taking the medication. But for the delayed type cutaneous adverse reaction, the time to develop reaction may prolong as long to 1 week, even to a couple weeks to develop skin reaction after taking the medication. Over the past 10 to 20 years, several risk factors have been found to be associated with cutaneous adverse reaction, such as genetic factor or some virus reactivation. Genetic factor of HLA earlier, such like HLA B15A01 or B15O2, have been found to be associated with certain common drug-induced cutaneous adverse reaction or Stevens-Jones syndrome, including anti-epileptic drugs such like carbamazepine, phenytoin, and lamotrigine, antibiotics such like Depsaba drug, or anti-hyperuricemia drug such like allopurinol. And some viruses have also been found to be associated with the severity or prognosis of DRACE, such like HHV6 or HHV7. Cutaneous adverse reaction can classify as an allergic or non-allergic reaction. The allergic reaction is so-called is mediated by immune reaction, including cellular or humoral immune reaction. The cellular immune reaction is mediated by T cell. The humoral immune reaction is mediated by antibiotics. So the common urticaria or maculopapular extension to hypersensitivity syndrome, such like DRACE or Stevens-Jones syndrome, all belong to allergic drug reaction. The non-allergic reaction to drug may be observed in patients with NSAID-induced angioedema or so-called pseudo allergy, or some drug-induced direct toxicity to the skin, such like chemotherapy agent or targeting therapy small molecule drug, such like EGFR receptor inhibitor, they can cause the direct toxicity to the skin. That is also non-immune, non-allergy drug reaction. There are several important issues in the progress or advance in the field of cutaneous adverse reaction. Firstly is the new cause or new threat. The immune checkpoint inhibitor for to increase immunity for anti-cancer therapy, and also new anti-cancer targeting therapy drug, as well as a new vaccine, such like an mRNA vaccine, COVID-19 vaccine. They all can cause the new threat or new cause for severe cutaneous adverse reaction. We have observed and increasingly reported cases related to the new threat or new cause of the medication or vaccination. The second important issue is a new diagnostic technique. With the progress of pharmacogenomic research, more genetic or biomarker have been identified to be strongly as predictor or for the prevention or early diagnosis for the scar. The third point is a new treatment. Comparing to the conventional treatment of severe cutaneous adverse reaction by using systemic corticosteroid, the many clinical trial research has shown biological such like anti-TNF-alpha or small molecule like a JAK inhibitor can also be used for the treatment for the severe cutaneous adverse reaction. with a superior efficacy and the lower side effect that may potentially provide new methods to reduce mortality or morbidity associated with severe cutaneous adverse reaction in the future. So with the increasing interest of severe cutaneous adverse reaction research, I'm happy to give a plenary session talk. I hope we can see you in Singapore 2023. See you soon.